Welcome back. In this video, we'll talk about Redman syndrome. This video is sponsored by Unacademy. It is caused by the medication vancomycin, and it occurs in about 5 to 13% of patients. The medication causes the release of histamine from all over the body, and this triggers symptoms identical to that of allergic reaction. Although it is very important to note that Redman syndrome is not an allergic reaction, but the symptoms are very similar. A few years ago, it was thought that Redman syndrome was caused by impurities in the manufacturing process. And now we know for sure that this is not the case, because even after intense purification process, we still get Redman syndrome in some patients. There seemed to be higher tendency to develop Redman syndrome if infusion was given fast. The symptoms develop within the first 10 minutes after infusion. The first signs of Redman syndrome is of course rash and redness all over the body. And it makes sense because histamine release will cause these symptoms. You should also look for swelling and puffing of the eyes and lips, muscle spasms, fatigue and pain, and sometimes difficulty breathing. The most serious complication of Redman syndrome is that in some cases it can cause heart failure and cardiac arrest. Unacademy is the largest Indian teaching platform. They have a variety of interesting topics and courses, and recently they have extended their courses to include topics for the USMLE and the Step 1 exam. The USMLE course checks all the important marks, including recognized names like Dr. Najib and Dr. Raj, and of course many other skilled teachers. It has more than 800 recorded lectures and comprehensive videos. Unlike all good courses, they also have their own Q bank with more than 3,000 questions and 300 review videos. For a limited time only, the course will have 75% discount with an additional 10% discount if you use my coupon AHMAD10. Once you purchase the course once, you will have free access for a full year. To treat Redman syndrome, of course, you should stop the infusion of vancomycin immediately, and you should also stop the infusion of any other medication that is also given at this time. Then give the patient antihistamines like diphenhydramine. And if you're suspecting that this patient will have Redman syndrome, you can give them diphenhydramine before giving vancomycin as a prophylaxis. And finally, use skin moisturizers and wet dressing on the affected skin areas. And here's a small quiz. And here is the answer. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helped.